Good morning, Hong Kong. Welcome back to another episode of Hong Kong Insurance 101. Last week, when we discussed the difference between local and international health insurance plans, we briefly touched on the issue of pre-existing medical conditions when it comes to considering the longevity of a policy. A pre-existing medical condition is strictly defined as any condition of which the policyholder has been diagnosed, displayed symptoms, or been aware of prior to their enrollment in a health insurance plan. Going back a couple of episodes to the definition of insurance, under health insurance, a condition that exists cannot be considered a risk. It is a fact. The condition exists. As such, it is virtually impossible, outside of some rare exceptions, to transfer the risk of something that has already occurred. Simply put, there is very little equity with regards to covering a pre-existing medical condition. Let's look at it this way. No insurer is going to offer fire insurance on a house which is already on fire, nor is an insurance company likely to give insurance to a car which is currently in the middle of an accident. This parallels into the health insurance world. The pre-existing condition could be considered the burning house or the destroyed car. The incident which would have been covered by the insurance has already occurred. Consequently, attempting to transfer that risk doesn't really satisfy the definition of insurance. Because of this, pre-existing medical conditions are a primary concern with relation to health insurance. Once you have a medical condition, it is very difficult to get it insured. As you get older, you'll be more prone to developing these conditions. It is because of this that it is important to obtain a health insurance plan that will work for you over the long term. The longer you're on the plan, the more likely it is that you would develop a serious medical condition. If you become unhappy with your insurer and want to change your policy down the road, the next insurer will likely not cover the medical conditions which were being insured under the previous policy. This means that it is extremely important to get the right health insurance policy now rather than going without the necessary cover should you decide to switch insurers at some point in the future. Next week, we'll look at some of the unlikely options available for covering pre-existing medical conditions. But until then, have a fantastic weekend. Please remember to like and subscribe, and don't forget to ask CCW. We're simplifying your insurance.